Something that's asymptomatic is a problem that a patient might have that he wouldn't realize or wouldn't know about because he's not having pains or problems or other symptoms or complications that would bring it to his attention. A great example of something that's an asymptomatic complication in prostate cancer is something like a fracture in the spine of a man who has metastatic prostate cancer. He may go around with a fracture in his spine for weeks or months until he ends up getting a scan if he doesn't have pain, and that can absolutely happen for some individuals. When he has a scan, his physician may tell him, you have a fracture back there, and if he never felt pain or had a problem with that, that would be an asymptomatic fracture. When one thinks about these kinds of symptoms and complications, it's important to recognize that an asymptomatic problem can be actually a really good thing. And as long as you find the problem in the end and find that issue and fix it, or at least address it, it's much better if you don't have symptoms, I think. Certainly no one wants you to have pain, and we would rather that it be asymptomatic. However, there can be problems related to asymptomatic complications, because if a man has a vertebral fracture or fracture in his spine that is not causing him pain, but for some reason is causing instability or causing his spine to not be as strong as it needs to be to hold him up, he could have a more severe complication in the future related to that fracture that he didn't even know about. And so there's really a balance. We want you to not be in pain, certainly, but sometimes it is helpful when we do have symptoms to draw attention to a problem.